Okay, so I'm going to get started. But thank you everyone for being here today. I'm excited to try out our first alumni office hours event. And as I said before, my name is Jen Bentley and I am the Alumni Advancement Officer for the Faculty of Health. And I'd like to acknowledge that much of the work of the University of Waterloo takes place on the traditional territory of the neutral Anishinaabe and Haudenosaunee peoples. Our main campus is situated on the Haldeman Tract, the land granted to the Six Nations that includes 6 miles on each side of the Grand River. Our active work toward reconciliation takes place across our campuses through research, learning, teaching, and community building, and is centralized within our Indigenous Initiatives Office. So again, I'm excited to welcome you all to our first ever Faculty of Health Alumni Office Hours event. And today featuring our Masters of Public Health alumna, Sarah Blades. Bringing back alumni to connect with students is an important priority for the faculty and the university as well. So I hope that this will just be the first of many opportunities that we're able to provide for our current students and alumni as well. Our alumni help show students what's possible. The success stories and the challenges that they've gone through help to shine a light on the path for you and help you, work towards what's next in your future. We are planning to host the Alumni Office Hours event series every term. So I'd love to hear from those of you who are joining us today. If you have any requests for careers you'd like to learn more about, or people specifically that you'd like to hear from, I'd love for you to share any feedback or ideas you have in the chat. So please feel free to share that with me either now or at the end of the event. And I said, I'll say this again, to make this small group session really engaging, it would be really great if everyone could turn their cameras on and make this more personal. I think it's always a little bit easier to have a discussion like this when you can see the faces of the people you're meeting with. And I'm sure Sarah would love it a lot more than just looking at a blank screen of boxes. So we'll do that for her and as a way to thank her for her time today. And just a little bit about the flow of the evening. Once I'm finished with some introduction, Sarah's going to tell us more about herself and her career journey and some things that she wants to share with you. And then we will also open up to a Q&A discussion for the majority of the time. So that'll be an opportunity for you to ask Sarah questions and have this be more of a discussion for the group. When we do get to the Q&A, I'd ask that you can either raise the virtual hand or you can put in the chat that you have a question, and then I will invite people one at a time to unmute and ask your questions to Sarah. So that leads me to introducing Sarah. So Sarah Blades has worked in the field of health promotion for the past 14 years, holding various positions within government and non-government organizations in Nova Scotia, Mi'kmaq. She is a graduate of the Bachelor of Science Health Promotion program and Bachelor of Science Psychology program at Dalhousie University, and she also holds a Master of Public Health from the University of Waterloo. Sarah has worked as a health promoter in the areas of injury prevention, community development, occupational health, safety and wellness, and currently in mental health and addictions at IWK Health. As a prevention and health promotion specialist, Sarah's role includes using upstream approaches to increase protective factors and reduce risk factors and inequities for children and youth. This work has implications in improving mental wellness for children, youth, and families in Nova Scotia and beyond. Some of the portfolios Sarah currently supports within her team include tobacco, vaping, and cannabis, suicide prevention and risk reduction, poverty, alcohol, and the industrial determinants of health. But I will let Sarah fill us in about all the details around her work and her experiences. And please join me in welcoming Sarah Blades.
Thanks, Jen. Thanks for your video applause. That's very sweet. Thank you. Jen, I really appreciate the introduction, and I appreciate your willingness to moderate the conversation as well. After, when we get on there, I was going to ask you about that. But today I have just a few highlights that I want to share. I wanted to say I'm really grateful for your time, because I know as a student, your time is spread in many ways. I was also very impressed, Jen, with your land acknowledgement. So I want to jump right in and say that the land acknowledgement is super important to some of the work that I do, but it really is much more than a land acknowledgement. I would encourage each one of us to find out what the land is that we sit on and where we do most of our work. Native-land.ca is a great resource if you're not really sure what treaties or what Indigenous groups on the land where you work and live. I'm assuming many of us are in Waterloo, but that's thanks, Jen. Many of us could be in Waterloo, but my program was a distance program, for example. So that's an example of where people could be from anywhere, and really need to think about that. And so I want to start by saying that there's probably 3 highlights and then a bit of my timeline that I'll share. The highlight around equity, diversity, inclusion, reconciliation seems appropriate to start, because that's sort of where we're at the moment. The importance of connecting with organizations and others, people in other faculty, interdisciplinary work, and perseverance. It's not ever too late to do the things you want to do. And so I just realized, saying that out loud, it sounds a little bit like a cheesy motivational speaker speech, but I'll keep it very real for us. And I just want to share that I'm grateful for this opportunity to give back to alumni as well, as I don't live in the province of Ontario. So it's hard for me sometimes to do like the traditional on-campus alumni type things, like an in-person networking or something like that. So equity, diversity, reconciliation, and inclusion. That work is really important to me, and I want to also acknowledge the land where I live, work, and play. So as Jen mentioned, it's Mi'kma'ki. I live in Halifax. The traditional name for Halifax is Chibuktuk, and it is the easternmost edge of Nova Scotia. The land acknowledgement is so much more than just understanding what the land is. We can apply the importance of equity, reconciliation, diversity, and inclusion to the work of public health really easily, I think, because until we understand the context in which each of us live, work, and play, there is little traction can be made when we don't understand what are those contexts. So, for example, Mi'kma'ki is covered by the treaties of peace and friendship. Peace and friendship treaties were signed in 1752, and they discuss the agreement between Indigenous Mi'kmaq people and colonial settlers, and what the terms of interaction would be. So one of the really important pieces for my work today, understanding the nature and content of the treaty is key to understanding why, for example, First Nations governance would allow and promote cannabis dispensaries when provincially we have one licensed regulator. So there is a right to a moderate livelihood, and you may have heard the news across the country, there's a moderate livelihood fishery that's been established in Nova Scotia as well. Specifically, the treaty states that Mi'kmaq people have the right to a moderate livelihood by selling any product, flora, fauna, fish. It's written in the language of 1752, so it's really interesting. But in order to acknowledge all of our responsibilities in the treaty, we're all treaty people, whether or not we sign them. Understanding the context of the treaties of peace and friendship on today's work around reducing harms for alcohol, drugs, cannabis, and violence and discrimination are key to the things that are going on in my portfolios now. Inclusion as well is super important. I include my pronouns in my signature on my email, and as well I've included them here today. So I use she, her pronouns. Hearing from and working with population groups that are equity seeking is super important as well. We know that accessibility as well is an issue in the work of public health. An example of that work would be some things that are ongoing at IWK Health, is the health center that I work at. We have federal and provincial legislation changing very soon around the accessibility, physical accessibility of our buildings. We work towards becoming a trauma-informed environment, and so that also considers indigeneity, trauma experience, choice, partnership, a lot of factors that would change how we might organize a waiting room, or how we might paint a room in a soothing color. We're not going to use blazing colors necessarily in our decorations. So I just want to make sure that when you leave today, number one, feel free to reach out to me at any time. Number two, think about the place and the context in which you arrive. So perhaps you arrive as someone who has lived and worked in a location for a long time. I've always lived in Nova Scotia. I've always worked in organizations based in Nova Scotia. So my context as a white settler in Nova Scotia is very different perhaps than someone who's arrived as a new Canadian on a student visa, or as someone who's always worked in the United States. I had a colleague who was born in Virginia and always worked in the United States for the FDA. So it was a really interesting perspective to understand a little bit more about what you bring and how you bring it to the work that you do. So that's EIDR, equity, diversity, reconciliation, and inclusion. We can talk more about that later, but I'd also like to offer a little bit on perseverance. So I didn't come to the career of health promotion entirely with intent. I was an undergrad student at Dalhousie 20 years ago, and I was trying to get into the pharmacy program at that time because I thought that's what I wanted to do. I wanted to be a pharmacist, but I wanted to be a pharmacist because I wanted to help people manage their medications. I wanted to help people navigate their health and their lives, basically. My chemistry marks were not sufficient to get into the College of Pharmacy. 3 times I tried to get into the college, and then I thought, you know what, I'm picking at this psych degree, this BSc. All of my favorite electives come from one school of health and human performance, of health promotion. I thought, well, why don't I just, and then I realized I looked in the catalog and saw that that degree comes with a practicum experience. So I was able to work in an organization for a semester at the end of my degree in health promotion, which gave me experience and connections to take me right to work. So I thought, well, why wouldn't I choose that instead? So that was my second undergrad in 2007. It is all about the things that might seem like they don't work out now, but will work out later. Like that's what I want to share, I guess, about perseverance as well. And it is something else I wanted to share. There was another one on there. Let me see. Jen said it beautifully in the outline and all the ads for our session today. Connecting, yeah, super important. So I'm not sure, we can talk more later about what programs everyone's in and what kind of opportunities we have within our programs to connect with outside organizations, people who work in industry. I just remember back to my undergraduate classes and even my grad courses were people who did work in the field that I was interested in. I thought made the best professors because they had real life experience in the work that I wanted to do. So when we get the chance maybe to build a strategy for an organization or help do an evaluation for a community organization project as part of a project for school, really nurture those connections with the organizations that you get exposed to. That is how I started my career in health promotion in Nova Scotia, and I still work with some of the people who I first worked with 14 years ago. So it's the connections that you make are super important. I guess a little bit about my timeline. So I started, again, always lived in Nova Scotia. I started university in 2001 at Dalhousie. I finished my psych degree and my Bachelor of Science in Health Promotion at the same time in 2007. So I took like the long route. I was also really involved in campus life. I lived in residence. I was an RA. I was on residence council. I did all those kind of things. I worked on campus. I lived on campus. I loved my undergraduate career. But when I finished my degree and I started working at the agency actually that hired me for my practicum, which was Child Safety Link. You can find them by Googling them. They are a regional injury prevention organization for children and youth, well, for parents and caregivers of children and youth. And the focuses are on child passenger safety, poison prevention, falls, playground safety, those kind of things. So it's a neat organization. But after I worked there for a few years, I thought, you know what, like really, if I want to do a different job other than an entry-level health promoter, I think I need to have a master's. I think I need my master's in something. And so I was sifting my options, knowing I wanted to stay working in Nova Scotia, knowing I wanted to stay, not have to travel for a program, and knowing math was not necessarily the thing that I liked the best. I was deciding between a master's in community health and epidemiology, health informatics, health administration, and public health. And at the time, there was a public health renewal in Nova Scotia. That's what they were calling it. So we went through a big change in our public health system in the government of Nova Scotia. And the word was that they're going to look for MPH graduates. So I started my MPH in 2009. I started out studying full-time and quickly realized that studying full-time and working full-time in an injury prevention organization was not going to be a thing that I could do. So I dropped down to a part-time student. So I finished my master's in 3 years instead of 2. And I was able to study and work at the same time. And then my practicum placement was a collaboration between the organization where I worked and as well the IDPK Regional Poison Center. So I was able to do some strategic planning for the IDPK Regional Poison Center. There's common perceptions in the public about the Poison Center, about how it's only for children or that kind of thing, but they actually do have a maritime-wide, all ages mandate. They even do veterinary exposures. So they needed a little bit of a strategic plan to help people understand what they were for. So I did some strategic planning. I did some HR management type of things. I helped to set up our St. John, New Brunswick office when I was at Child Safety Link in my practicum. And that was sort of my focus of my master's. Although it was course-based, I didn't pursue a thesis-based master's. My areas of focus were around not-for-profit, health promotion, leadership, and management. So those are the skills I think that I brought with me most clearly from my time as a master's student. When I finished my master's, I started to work for another health authority. So IWK and NS Health are 2 separate health authorities in Nova Scotia. We can talk more about that later if you want, but basically it means those are the organizations that are tasked with delivery of care in Nova Scotia. So I started to work for the big health authority, for Nova Scotia Health Authority, because my life evolved. I got married, I moved out of town, and I thought, oh, I should probably get myself embedded in this system so that I can eventually do some of that healthcare leadership stuff that I want to do. Team management, psychological safety in the workplace, those kind of things. So in order to get into that organization, I took a role that maybe was fun for some people and not as fun for me. I was a community health board coordinator, which sounds awesome and was awesome in lots of ways, but it was just really different. I had always worked like a 7:30 to 3:30 office, Monday to Friday kind of job. And being a community health board coordinator is not that kind of job. So 18 months later, I moved into some work at the health authority as well in occupational health and safety. So I was a workplace wellness consultant or coordinator for 6 years in the health authority. And essentially, the way I looked at it, or the way I described my role there in an elevator pitch, was it was my job to help the biggest employer east of Montreal be a healthier, happy place to work. So everything from benefits conversations to offering of programming, negotiating discounts with wellness facilities, policy around psychological safety and embedding that, trust, partnership, accountability, recognition type things in the workplace. I also managed the promotions and like the motivational effort for the staff immunization, flu immunization campaigns. So basically to try and coerce health staff people to get their flu vaccines. So there was some evaluation in there. There was some data management. It was an awesome job. And then the job of like my dreams comes up here at IWK Health. So I brought with me my community development experience, my big health authority experience, and other skills to the field of health promotion within mental health and addictions at IWK, which is a child and youth and family health center in Halifax. And when we think about health promotion, what comes to mind sometimes is health promotion programming, but we like to think about health promotion or prevention on a spectrum. So my role exists in the upstream spectrum, where we focus mainly on changing and influencing, providing evidence, and helping the organization be an advocate for healthy public policy. Healthy public policy is like my favorite thing. So, and I know that sounds kind of strange, but I really believe that we can do so much more work with healthy public policy than we can with programming type interventions, because a policy or legislation or those kind of interventions touch people without them even knowing they've been involved, or they benefited sometimes from a policy change. Whereas a program requires us to recruit and facilitate and those kind of things. Now, that not to say that I haven't done lots of that in my career. My workplace health promotion role had a lot of facilitation and a lot of programming type things. We started a program called, or we were the implementers of a program called The Working Mind from the Mental Health Commission of Canada. The post-secondary edition is called Inspiring Minds. Or Inquiring Minds. People might be familiar with that. But I did a lot of facilitation in my workplace health role. I do realize that I left out a little piece about my non-government organization experience. So between my master's and coming to the big health authority, I worked for a non-government organization, which did injury prevention policy for the maritime provinces, the Atlantic provinces, actually, including Newfoundland and Labrador. So it was a collaborative. It was called the Atlantic Collaborative on Injury Prevention. And I helped to represent Atlantic Canada in the national stage for injury prevention. So things like when New Brunswick made their law to require children to use booster seats who were under a certain age. That happened while I was holding that network position as the exec director at that time. So sorry, that was a little bit out of sequence, but those are the things I want to leave you with, and those are the types of things that I want to share about my experience. But I'm really happy to answer your questions. I recognize it's 5:30 my time, but 4:30 your time, and I want to be sure that we leave the half hour. So Jen, if you want to take it away, that would be wonderful.
Sure, that was great, Sarah. Thanks for all of that background and great information. And moving into the Q&A, I was thinking, instead of making everyone kind of go around and introduce yourselves, maybe everyone could just put something in the chat that just says, are you a current student, undergrad or master's, PhD? Are you alumni? Just something a little bit about yourself, your program, so that Sarah and I can see that. And then whoever is ready with a question, you can raise your hand or Just also put a note in the chat that you're ready for a question. I'll just kind of go through them. But I wonder, Sarah, if there's any questions that were submitted in advance, if you want to grab one of those to start with.
Sure, yeah. Someone had asked a really interesting question about connections between nutrition and mental health. So this is, and I'll apologize in advance. I'm a little bit of like a fire hose talker, so I'll just talk in a circle sometimes, but hopefully I can leave you with some stuff to follow up on. So someone asked what I felt the implications of nutrition on good mental health would be, because I work in a mental health role, and public health has a real, often has a branch for nutrition, food access, those kind of things. So the way that nutrition would intersect, I think, with the type of role that I do would be around access to food and food security. That's a huge part of, I think, acceptable neighborhood conditions for people, which we know are a huge determinant of health. So to say that the three main social determinants of mental health that guide my work are social inclusion, freedom from violence and discrimination, that's where the EIDR stuff comes in, and access to economic resources. So food security and access to housing and food that's appropriate and acceptable for me as the person who I am in my context. Maybe I am vegetarian, or maybe I follow halal food requirements, or these types of things. It's important to know that access to food that is appropriate, accessible, affordable, and nutritious for me is a building block towards mental health. So I think that's sort of where it integrates. I don't know if your question was more, or if the question was more about how might a person eat to preserve their mental health, because we can think about that on the prevention continuum as well. So I think about it as an upstream policy measure to make sure that food security is important to cities and provinces. But we might also think about nutrition on the individual level. When a person experiences mental illness, what are the things they can do to keep themselves well? And one of them is to be hydrated, stay connected with people, and eat food that that fuels them. So, you know, I'm not a clinician in any way. I've never been a nurse. I admire all the healthcare professionals that I know. And I think of the prevention lens in a way that's different, I think, than a care provider. Just reading where people are coming from. That's awesome. So someone's in health informatics. Awesome. I was thinking about that too. So the reason I was interested in health informatics was because we don't have a vaccine registry in Nova Scotia. How sad and unfortunate is that at the time of pandemic that we do not have a vaccine registry? So basically we have, of course, we have public health information systems, but we used to have 9 district health authorities. So depending upon where you were born in this province of less than 1,000 or less than 1 million people, your vaccine records might be in a file drawer, or they might be on a local system, or they might be in a written chart in your family doctor's office. There's so many different ways that we capture vaccine information. And that was also very evident in my work with respect to the healthcare workforce and trying to understand what proportion of the healthcare workforce had their flu vaccine. So I'm super interested in data in that way.
So does anyone have a question they'd like to ask Sarah? Everyone just came to listen, I think.
No worries. There's someone in the chat who asked a question. They'd like to know, what is my recommendation for networking with employers who are interested in hiring students? So we are actually actively recruiting as of the beginning of October for an MPH practicum student, which can be done virtually. You don't have to come to Halifax for that. But my suggestion would be to go to your career centers or go to your preceptors for your for the practicum course. Speak with alumni about the jobs that they do and where they maybe did their internships from your program. Sometimes organizations, if you think of an organization that you might want to work in, so say you like work to do with sexual health and gender affirming care, look up those types of services in the city where you live, and then maybe speak to an administrator there about the kind of thing that you might want to do. I think it's really all about networking in finding people and places who are interested to mentor students. It can be difficult, but cold calls on LinkedIn, I've responded to I don't know how many, just to be like, yeah, sure, I'll talk to you about my job. I think it's a good, and if you get a response that's no, or if you get no response, then that's not necessarily meaning that you may not speak to anybody from that organization ever. It means not right now, or not this time, or not that person. But that's again about like the perseverance bit. I can't tell you how many times I've been declined for job interviews, for jobs that I thought I was perfectly qualified for, and I found out that they were awarded to people who were clinicians instead. So, in healthcare, it's a little bit fishy that sometimes we award leadership roles to people who are just clinicians, people who've been clinicians for a really long time. We've said, you know what, you've been a great nurse for 30 years, and now it's time for you to manage this unit. Does that mean they know anything necessarily about people management? No. Does that mean they know lots about how to be an excellent nurse? Yes. And they can support nurses to do that? Awesome. But sometimes that's frustrating. So I think that thinking about perseverance and trying to get, just get in contact, cold calling, LinkedIn pages, recruitment ads.
Yeah, I agree with that. I think people would be surprised how many responses you can actually get from cold LinkedIn messages.
Totally. Especially when you show who you have in common. Be like, I see you know this person. Do you want to talk about this thing?
Yes. Or when they're alumni. I mean, so I forget where I first reached out to you, Sarah, if it was in LinkedIn.
It was.
I think it was LinkedIn first. So, it also works when you graduated from the same school. Yes. But Nicole has a question, and then Maria, I think also. So we'll go Nicole and then Maria.
Sure. Let's see here. Nicole.
Hello, should I unmute myself?
Oh, hi. Yes, thanks. Sorry, I thought you were in the chat and I was like reading down the side of the
screen. No. I also live in Nova Scotia. And I have been here almost my whole life. Since I was like 5. Anyway, and I also went to Dalhousie for my undergrad. I did neuroscience. Awesome. And now I'm doing the Master of Public Health course based from Nova Scotia, similar to you. And I do have a lot of other questions that are Nova Scotia specific that I will probably ask you after this session. But for now, I guess one of my most pressing questions is, I know you said that you've kind of worked in Nova Scotia your whole career so far, but do you know, I guess, of any tips or maybe advice for if I was considering maybe like moving provinces? Like I was considering how cool it would be to maybe work in Ottawa for a little while, but I would like to come back to Nova Scotia and kind of, settle down, raise a family here, just not quite yet. So I'm just wondering if what your thoughts are, I guess, on whether that would be difficult just because there can be so much difference between provinces and their health authorities and that kind of stuff.
Yeah, that's a really good question, Nicole. What I certainly learned during my master's is that the health delivery systems, if we want to think about working in health delivery systems, are not apples to apples across the provinces. So I remember learning at Waterloo in my public health systems class, or it was a systems class or a management class, something about local health information networks like the LINs and the public health units being different from healthcare and stuff like that. That's not the case here. It's all one pile in Nova Scotia. There's one organization basically that does the whole thing. So imagine trying to do the work of public health within the work that is also now, this is a weird context because pandemic, but that's also wrapped up in the work of hands-on public health care. So thinking about the healthy built environment pieces, public health inspection belongs to the Department of Environment in Nova Scotia, for example. It's the wild, wild east, I like to call it. So there's big differences between how things are orchestrated, and we can learn things from each other. So we saw coming down the pipe, the amalgamation of healthcare organizations in Alberta happened a couple years before Nova Scotia Health Authority was formed. So Nova Scotia Health Authority was formed in 2015. There were 9 district health authorities before that, and the amalgamation of health authorities happened in Alberta too. So it was one of my objectives to be like, okay, how did staff people take that and in Alberta, and how do we think people will react in Nova Scotia? And it was the blazing same, like exactly the same. So all that to say, I think that experience in other provinces is important. And if you want experience that's transferable, I think there's lots of things that are transferable about any interest piece that you could ask for experience in. But something that's directly lateral would be federal work. So it all depends on how close you want to be to clients or communities or that kind of thing. Because with federal work, you're a little bit removed sometimes. But you mentioned Ottawa, for example. That's a big federal hub. So the Public Health Agency of Canada. I have colleagues who work there, who have worked there. Economic Social Development Canada, ESDC, I think it's called, also known as Service Canada. Lots of people who work in that type of role, in a programming role. So around supporting conditions for migrant workers. Like I feel like there aren't very many limits with respect to a career in health. Like there are a lot of opportunities, and it just depends upon where your passion is and who you can make connections with in that passion.
Wonderful, thank you.
No problem.
Great. We will move over to Maria. If you want to unmute, you can ask your question. And then I'm going to ask Shani's next in the chat, and then we'll keep going to those of you who've raised your hands.
I'll just quickly introduce myself. So hi everyone, my name is Maria. I'm currently in my 3rd year of public health, and I'm also employed for the Faculty of Health as a social media assistant. So I was here to make some notes on this office hour with Sarah Blades, and it's been a really good one. I was also hoping to get a quick screenshot of everyone, maybe like putting a thumbs up or just like smiling. If everyone is okay with that, that would be great. I'll do like a 3, 2, 1 or something. But also, if you're not okay with that, you could just turn off your camera for the time, and then I'll just screenshot and you'll be fine. You won't be in the picture. But I was also wondering, I had a quick question before we do that. If IWK, I'm pretty sure that's where you're currently employed, right? Does IWK have any social media or any sort of LinkedIn profile where people could reach out to if they wanted to learn more?
Yeah, for sure. So IWK definitely has a LinkedIn page. There's definitely a Facebook presence for the IWK. I think they're also on Instagram.
Okay, cool.
So you could, and I think my program actually, I just saw come across my Instagram the other day, Mental Health and Addictions at the IWK is, just has launched a profile as well. But if you want to get a hold of me and my team, I'll put this email address in the chat, because this is also the way we're going to recruit students, is via this email address. So I'll pop that in there.
Great. So Maria, do you want to do the screenshot now?
Yeah, sure. That would be great.
Hopefully everyone on screen is good. Anyone who doesn't want can just turn theirs off quick. And you can give us the countdown, Maria.
Okay, so I'll do the countdown in 3, 2, 1, smile. Perfect. Okay.
Thanks.
All right. You guys like that on Twitter very soon.
Awesome. Yeah. You can tag the IWK in it as well on Twitter, I think.
Okay. Perfect.
Okay. Was that everything, Maria? Great. So we'll take a look at Shani's question in the chat. It says, what did you find were the differences between government organizations and other organizations you have worked for, maybe in terms of the structure of the industry?
Yeah. So my experience in government organizations. So I would consider government organizations to be like, it's kind of strange the way that my non-government organization was actually just a collaboration of provincial governments and not-for-profits as well. But I find the farther away you get from provincial government, the more nimble sometimes you can be. And the size of the organization really makes a big difference. So for example, Nova Scotia Health, as a sort of side arm of government organization, so government funded, government oversight, but tasked with the delivery of healthcare, was very not nimble. It was like pulling teeth to try and get anything done. Big layers of bureaucracy. So I had a manager who had a director, who had a senior director, who had an executive director, who then we had a vice president to oversee something. And then, so the distance between myself and the CEO was like 75 layers. Like that, I would never have been able to know who that person was. And it was a little bit ineffective because it was just a forming organization. So that's a big, deep organization. I struggled with sometimes that type of setup and that structure. I don't experience that at all at the IWK. So the IWK employs about 3,500 people and about 1,000 physicians. We have direct correspondence, my team, with our vice president and CEO. Very supportive. Both of those people are very supportive of the work that we do for healthy public policy. It's just a matter, I think, of the organization itself being grounded, being committed to transparency and being open, and just where they are in their life cycle too. So when I worked, so Child Safety Link, where I first worked, is also hosted by the IWK. So I'm a person who started at the IWK, went around to non-government work, to the big health authority, and back to the IWK. We call them the IWK boomerang because it's a really great place to work. People start there and think, this is great. And they go and see if the grass is greener, and it's not, and they come back. So it's, I'm super lucky to have that kind of role. But so the nimbleness is a big difference, and as well the distance to impact. So when I worked in Nova Scotia Health Authority, and when you work in public health generally, sometimes the seeds you sow today will not be realized until people who will be our grandchildren will have children, kind of thing. Like, you know, planting those healthy public policies and changing structures and institutions takes a really long time. But I think when I worked in Child Safety Link, which did have a patient, family, client, public-facing mandate, I used to help people with their car seats, people who had given birth to babies at like 27 weeks, finally leaving NICU after months and months in the NICU. Helping them with their car seat on their first ride home was like a very special experience to me. So and also when I was a community health board coordinator, so that was very close to the public. That was like directly involved with community organizations, and the passion and the volunteerism that I saw in those organizations, I've never seen anything like it before or again. It was super moving for me. I really enjoyed that facet of the work. So I think really those would be the main differences, I guess. You know, feeling immediate impact and reward sometimes doesn't come as easy for me in a bigger public organization than it did in smaller not-for-profits or smaller settings. But again, that's just my experience. So could be totally different for others as well.
Thank you.
You're welcome. Thanks for asking.
Okay, I think Samara was next. Hopefully I pronounced her name correctly.
Yeah, it's perfect. Yeah, Samara.
Great.
Hi, everyone. And thanks so much, Sarah, for talking about your journey within public health and all your experiences. I'm actually a first-year student in the MPH program as well. So it's amazing to hear. I guess my question would be, is that I know you talked a bit about the skills that you acquired during your experiences. And besides like those soft skills, are there any skills that you would think a student like myself would find surprising or should cultivate during my program before I jump into a health promotion career, I would say, or maybe the practicum, because I am interested in a career in health promotion. And I was talking to another individual in the field and they said that something that they never knew that they would do is grant writing. So just recently I got into grant writing and also cultivated that experience. So I'm just wondering if there's anything that you would say that an MPH student should really learn now, and as well as the skills.
For sure. So yeah, I can speak to that. Absolutely. That's a really interesting thing to point out about health promotion work. And when I think about grant writing, health promotion work that involves grant writing might exist in a health charity or a health promotion organization, or helping a community like if I worked in a public health unit, maybe I might help a neighborhood group or a school advisory council write a grant for a new playground that was safe and healthy, or those kind of things. So yeah, grant writing, important. We did some grant writing actually recently on something called the Anti-Racism Action Project from Canadian Heritage, the Department of Canadian Heritage, and we were able to be funded. The IWK as a workplace was able to be funded to do some anti-racism work in diversifying our workforce and helping our patients and families feel represented. So grant writing, absolutely. Something else is evaluation. So your evaluation course is an entire course by itself, but those methods are key later on. Like my team is fairly new, and in that it's expanded from 1 person to 4 people over the last 2 or 3 years. And so what I would really like to see is a contribution analysis. So how can we use the different methods of evaluation that we learned about in theory, making sure that you know how to operationalize them in practice is helpful for me in my role. Like that's something that I never thought that I would ever think about ever again. And I hate to say it, but like some of the math pieces aren't really as applicable to my role. Like, you know, understanding validity, important. Being able to calculate something from data. There are other researchers for that. That was not the path I walked. So choosing carefully about, I think, what your thinking what your sector is, and then speaking to someone actually who works in that sector as well, would probably be key about the skills that they use. So something that I thought that I wasn't going to use that I did was public speaking as well. And it's, and facilitation, adult education principles, those kind of things. It was really, really important in my work at the Health Authority and workplace health promotion as well. So that's kind of like the skills bit.
Yeah, that's amazing. Thank you.
You're welcome.
Great questions. Okay, I don't want to pronounce your name incorrectly. Adiola?
Yeah, that's fine.
Could you say it so just so I know how to pronounce it correctly?
Adiola.
Adiola.
Yes.
Thank you.
Yeah, no worries.
Go ahead.
Thank you. Thank you, Sarah, for the information so far. We really appreciate you spending this time to just help us out with our careers. The question that I have is about the course itself, like the Masters of Public Health. Right now, we don't have like a definite course that you have to take for health promotion. So how do we tailor our courses to health promotion?
I think that the opportunity, so I came from a health promotion undergrad background, so that's sort of like the basis from which I saw the public health work. And I also respect that some people come as clinicians, some people come as undergrads from science or anthropology or those things as well. So my suggestion around choosing your courses might be, I haven't looked at the calendar in forever, but if there's anything about health equity, if there's anything about social determinants of health, if there's anything about community development, I think those are 3 key things from health promotion that I took with me towards my public health career that were really important. But again, I don't know the calendar, so I'm not really sure if those types of things are available. One course that I thought was really interesting that I actually took on agreement, because there's still some sort of agreement with the Southern Ontario universities where you can like pay your tuition to Waterloo, but take a course at U of T. I feel like I remember something vaguely from like 10 plus years ago now about that. But I took a course called Cells to Society, which was a tobacco course that took a look from the physiological aspects of tobacco and the mechanisms of a cigarette, all the way to the biology of nicotine metabolization and commercialization of cigarettes, all this. And I took that course well before vaping even was a thing.
Mm.
So I would be super excited to audit that course again if it existed, but knowing that some of those content courses too will help you get, you know, some exposure to the health promotion piece. But again, health promotion is a continuum. So some people think of health promotion as being like a smoking cessation program or a healthy eating program for shift workers or those kind of things. And that is a facet of health promotion, but health promotion is so big and wide. It's hard to say, I think, where if one course could prepare you more for a health promotion career than another.
Okay, thank you.
You're welcome.
Does anyone else have any questions?
I'm just going to sneak through the list there.
Yeah, I was just gonna say that we could check, see if there's any others that jump out at you, Sarah, and if anyone thinks of any more.
Oh, somebody wanted to know about the day in the life.
Yes,
What's the day in my life like?
tell us about that.
Okay, so a day in my health promotion life right now. I've been working from my home office since March of 2020. I can say that 100% of my work that I have to do is capable remotely. So that's a neat facet of my job. I connect with stakeholders, working groups all the time, just like this. So that's also why I said yes to Jen right away, because this is not weird for me. This is what I do all day. Sometimes I just feel like I'm screaming into the void, but it's nice to see people's faces as well. So now that work has sort of restarted a bit around things that aren't COVID related, I could be doing anything from meeting with urban planners about housing policy in Halifax to preparing remarks for an opportunity to speak at law amendments when recently in Nova Scotia, we passed some of the strongest vaping legislation in the country, which is interesting. Banning flavored vape products and restricting nicotine caps in Nova Scotia. Before that was a conversation federally. So we were super excited about that. And I had the opportunity to speak before the legislature about the evidence that would support why we would choose to do that in the protection of youth from nicotine addiction. So it's and nicotine exposure really to the developing brain. For the neuroscience folks, you know what's up with that. It's not ideal. I could also be reviewing correspondence through to our executive leadership team. So for example, we just got a new provincial government in Nova Scotia about a month ago. And so our executive leaders will be meeting with party leaders, new ministers and whatnot. So we want to be sure that some of that great groundwork that we had established in the past 3 years or so can be maintained, even though our government changed significantly. And just learning about how that government wants to talk about public health and protective factors might be different language than the previous government, but we want to prep our leaders in having those conversations as well. So I could be doing any number of things. I love learning. I love sitting on webinars and sharing with our counterparts across the province about different topics. I could be meeting with school administrators about how to figure out how to address their vaping problem in their school, as they put it. Like there's all kinds of different things but what my job doesn't involve would be maybe talking to groups of students or parents or hosting community meetings or those kind of things, because my role is broad in that that the things that we do have to impact most Nova Scotians in order to get the best bang for the buck of the public health niche where we sit. So that's sort of where we see prevention as being in the upstream piece in improving healthy public policy. And that I try and get up and drink my water as much as I can, but like a lot of it is like this kind of thing.
So just taking a look at the time, it's almost 5. So I just wanted to let everyone know I did put Sarah's LinkedIn in the chat. And Sarah, you did say this a while ago. I want to confirm before I share it with everyone. Are you okay if I share your work email with the group?
Yeah, that's no problem at all. I think my personal email is probably on my LinkedIn, so whatever's on there is fine. But yeah, work or personal is just fine. I may not respond super quickly, but I will get back to you, and I will look forward to talking to anybody about anything that we talked about or anything you have questions about at all. I'm super excited for all of your careers and all the things you're going to do. I keep an eye for names for students that I've had and people I've connected with all the time. So I'm happy to have met you all, and I thank you for your evening.
And thank you so much for, sharing your time with us. I think everyone who is here is really happy to have been here and heard from you, just by the questions that have been asked and the engagement. So thank you to Sarah from me personally, from everyone who's on the call, and thank you to everyone who joined our first alumni office hour event. There will be more this term and next term moving forward. So if you have any ideas of speakers or other careers you'd like to hear about, please feel free to throw some of those in the chat now. But otherwise, you can look forward to future events, and maybe you can tell your friends and other students what this was like so that they know for next time, and maybe we'll start to get some bigger groups out. So yeah, thank you so much to everyone. I think this was a really successful first round. So
I'm glad.
yes, it was great.
Great. Okay. Have a nice
yeah, so thanks everyone, and enjoy your evening.